Good afternoon, everyone, and welcome to the COVID-19 Vaccine Town Hall for people with disabilities and health conditions. This event is hosted by the Mayor's Office on Disability and produced by the virtual outreach team of the COVID Command Center. Some housekeeping for today. Today's event is being recorded and being streamed live on Facebook. Closed captioning and ASL interpretation are available. To activate closed caption, select the More button at the bottom of your screen and click Closed Caption. The ASL interpreter will be spotlighted for the duration of this event. To view the ASL interpreter as a larger thumbnail during a slide presentation, please click on the View button in the upper right-hand corner of your screen and change to side-by-side speaker view. In between the slide presentation and speaker views, there is a gray divider line that you can slide left or right to increase the viewable size of each side. Once the slide concludes, please return to speaker view. We respect all participants in this convening today and want to create a safe space for all. By default, all participants will be muted and video is disabled. Video will be on for speakers only. Q&A. To participate in Q&A, please open the chat by clicking the chat button at the bottom of your screen and send your questions to the person labeled Q&A, Katie Tang. Please note that every effort will be taken to answer previously submitted questions and those submitted through the live chat during the event. If you are unable to use the chat to ask your question, please contact mod@sfgov.org or 415-554-6789. Any remaining unanswered questions will be followed up post-event. Thank you. Get tested, San Francisco. You can save lives and stop the spread of COVID-19 by getting tested through your healthcare provider. If you don't have health insurance or can't get tested through your provider, visit sf.gov/gettestedsf or call 311 for information on getting tested at a city-run testing location. A safe and effective COVID-19 vaccine, coupled with continued preventative measures, are our best tools to end the COVID-19 pandemic and safely reopen San Francisco. Go to sf.gov/COVID vaccine for information on eligibility, vaccination sites, including locations, and links to book appointments if available. We are in this together. We can only reopen safely as long as we all stay vigilant and wear face coverings, practice physical distancing, and avoid indoor gatherings with members of other households. Go to sf.gov/reopening for more information. Today's agenda is as follows. And now at this time, I'd like to hand the floor over to Nicole Bond, Director of the San Francisco Mayor's Office on Disability, for some opening remarks. Director Bond, the floor is yours.
Thank you so much. Hello, everyone. I'm Nicole Bond. I'm the Director of the Mayor's Office on Disability, and I am very, very pleased and excited that so many of you have been able to join today to learn about the disability community and vaccination for people with disabilities and health conditions. I'm especially pleased that we have our colleagues from Department of Public Health with us who are going to provide most of the information that you'll be hearing today. And I'm really so glad that we've been able to work together so closely to make the vaccination experience as barrier-free and as accessible as possible for everyone. With all of that known, we also know that there is much more that we need to continue to do. So the aim of our talk today is to give you as much information as we can and then answer questions that you've provided to us in the best way that we can. If for whatever reason we're not able to address everyone's questions today, please be assured that the Mayor's Office on Disability will assist in getting those answers to you. But this town hall is just a really great way for us to get information to all of us in community. And so with that, I would like to turn the time over to our colleagues in Department of Public Health, and specifically Dr. Navina Baba. Thank you.
Great. Thank you so much for those remarks, Director Bond. And just as you mentioned, I'd like to invite Dr. Navina Baba from the Department of Public Health to talk about COVID-19 vaccines. Dr. Baba, the floor is yours.
Great, thank you. And thank you, Director Bond. Appreciate the introduction. So today we are here to talk about COVID vaccine, provide an update, as well as give you information on how to connect to vaccine. Next slide, please. So the presentation there's 4 main topics that we want to review. One is a vaccine overview. The second is vaccine distribution. The third is vaccine eligibility. And finally, the fourth is vaccine sites, including access to those sites. Next slide. So vaccine overview. This is just basically to mention that vaccines are the 3 vaccines that have been authorized by the FDA are safe and effective. Those 3 vaccines include Pfizer, Moderna, and Johnson & Johnson. All 3 are highly effective at preventing hospitalization and death from COVID-19. All 3 vaccines were tested in clinical trials involving tens of thousands of people. And all 3 vaccines, the FDA made sure that they met the safety standards and that they protected adults of different ages, races, and ethnicities. Over 70 million people have received at least 1 dose of COVID-19 vaccine, and there have been no deaths attributable to any of the COVID-19 vaccines. You cannot get COVID from the vaccines. There is no live coronavirus in any of these vaccines. Next slide, please. And then this is just some information about what you can potentially do after getting vaccinated, because this is a question that a lot of people have. This is some new information that came out from the CDC within the last week. We are waiting for the state to adopt this guidance, but expect them to do so soon. So fully vaccinated people, which is defined as getting or being 2 weeks out from your last dose. So whether it was a 1-dose Johnson & Johnson vaccine or a 2-dose Pfizer or Moderna vaccine, being 2 weeks out from that, you can visit with other fully vaccinated people indoors without wearing a mask or physically distancing. You can also visit with unvaccinated people from a single household, as long as those unvaccinated people do not contain anyone who is at high risk for severe COVID-19. So the other household would have to have low risk individuals. And if you're indoors, you can visit with them without wearing a mask or physical distancing. And then you can, if you are fully vaccinated, you might not necessarily have to quarantine after an exposure. In general, however, given that there's still a large percentage of the population that is not fully vaccinated, while in public, whether you're vaccinated or not, you should still be wearing a mask and maintaining physical distancing. And you should practice all the prevention measures that we've talked out throughout the pandemic about, including hand hygiene, again, physical distancing, and wearing well-fitted masks. And then everyone should avoid medium and large size in-person gatherings. Next slide, please. So let's talk a little bit about vaccine distribution. Next slide. So the state and federal government are driving the prioritization and allocation process for vaccine. San Francisco is required to follow the state's recommendations for prioritization and allocation of doses. The state continues to update its plan for fair distribution, ensuring those most at risk get vaccinated first. I just want to add to this point that the state guidance continues to evolve, and as that guidance evolves, we adopt that guidance. Our guiding principles here in San Francisco include equity, getting vaccine out in a speedy manner, and ensuring that that happens through partnerships with our community partners. Next slide. Vaccine eligibility. So a lot of people want to know, when can they get vaccinated? As mentioned, people are eligible for vaccine based on the state's California's prioritization plan. To see if you're eligible to get a COVID-19 vaccine, you can go to sf.gov/getvaccinated, or you can call 833-422-4255. If you're not currently eligible, you can sign up to be notified when it's your turn. And the website for that is sf.gov/vaccine notify. Next slide. Let's go through vaccine eligibility. The first phase of vaccine eligibility includes phase 1A, which we started vaccinating in December and continue to be eligible. These were our healthcare workers as well as our long-term care residents. The next phase that became eligible, which we are continuing to vaccinate, were individuals over 65 years and older, and then certain sectors, including education and childcare, emergency services, and food and agriculture. And then as of March 15th, this last Monday, another sector was added, or another group was added, which included individuals ages 16 to 64 that were deemed to be at high risk for COVID-19. And this included people with certain qualifying conditions, for example, certain health conditions, disabilities, and people experiencing homelessness, or those who live in or work in high-risk congregate care facilities. Next slide, please. So to talk a little bit more about who became eligible on Monday, we're going to go through a bit of the list. Most of this list is taken from the state. I will talk about a couple places where we've been a little bit more open here in San Francisco. So in terms of health conditions, those that have active cancer, those that have chronic kidney disease, people who have severe chronic pulmonary disease, including COPD, or those who are oxygen dependent, people with Down syndrome, people who are immune compromised from blood, bone marrow, or solid organ transplant, those with immune deficiencies, HIV, use of corticosteroids, or use of other immune weakening medicines. People who are pregnant, people who have sickle cell disease, those that have heart conditions, such as heart failure, coronary artery disease, or cardiomyopathies. This excludes people who have hypertension, obesity with a body mass index of over 30. And here is one place we differed from the state. We took the CDC's guidance on who was most at risk in terms of obesity, and the data and science show that obesity with a BMI over 30 were at high risk. And then diabetes. Again, this is another place where we were more inclusive than some of the guidance coming from the state. The state said diabetes type 2. We know a lot, diabetes type 2 in general is the most prevalent form of diabetes. However, a lot of people don't know what type of diabetes they have. And so we wanted to ensure that people who had diabetes had access, and so we're a bit more open for public health purposes. The other group that was included were people who had disabilities, including those with developmental, medical, physical, sensory, or behavioral health, including severe mental health and/or substance abuse disorders. And finally, the third category was people experiencing homelessness or who live or work in high-risk congregate care settings, including correctional facilities, homeless shelters, and other congregate residential care and treatment facilities. Next slide, please. Another place that we've gotten a lot of questions is on how are we verifying vaccine eligibility? We in San Francisco have asked providers to use reasonable processes and to avoid overly burdensome documentation requirements in verifying eligibility. Vaccination sites that do not have access to patient medical records should not require proof of diagnosis and/or disability. Reliance on self-attestation may be more feasible and equitable. Healthcare providers vaccinating their own patients can make a reasonable attempt to verify qualifying conditions via the patient's medical records. They can also use their clinical judgment in assessing risk. Now turning to vaccination sites. Where can someone get vaccinated in San Francisco? If you are eligible for a vaccine, your doctor's office and healthcare provider may contact you to schedule an appointment based on available supply. Additionally, the City and County of San Francisco has created options for people to obtain the vaccine in a way that is most convenient and comfortable and safe for them. These options include high volume vaccination sites, community access sites such as clinics, community hubs, and mobile vaccination, and pharmacies such as Walgreens and CVS. I will say that San Francisco has the capacity to vaccinate up to 17,000 people a day. We are not at that capacity because we are not getting that type of vaccine supply. But once vaccine becomes more available, we do expect to be able to reach that capacity quickly. Next slide, please. For those who need help in getting vaccine appointments, we do have a call center that can help link to certain vaccine locations. This call center number is 628-652-2700. The San Francisco call center will help link people to some locations, and specifically these are people who are over 65 years and older, or those who have disabilities who are unable to easily access the internet to schedule an appointment. We do expect that there will be more options and more another number available for the state-run sites as well. Next slide, please. In terms of being able to get to a vaccine site, these are some important transportation options that we wanted to share. Muni and paratransit are free to and from your appointment. On Muni, show your vaccine card or proof of your appointment. You can also show an email confirmation or a photo of your card. And this is a vaccine card that you will get once you get your first vaccination. Paratransit SF Access van riders must call to make a trip reservation. Tell the operator that you're going to get a vaccine. Paratransit taxi riders will have $60 loaded onto their taxi debit card. The funds are valid for up to 6 months. To get more information, call 415-351-7000. And the next option includes the Essential Trip Card, which subsidizes about 2 to 3 round trips by taxi per month for older adults. Those are persons 65 and older, and for people with disabilities. Eligible participants pay 20% of the taxi fare for essential taxi trips. Next slide. To get more information on vaccine, there are two websites that I want to point you to. The notification website, which we talked about earlier, is sf.gov/vaccine notify. And then for information about where to get vaccinated, you can go to sf.gov/get vaccinated. At these websites, you can find out who is eligible and what to do when you're eligible. There is a site listing of all vaccination places, including location, phone numbers, and hours. You can book an appointment. There's also information on partners who are vaccinating. You can sign up to get notified when it's your turn. And you can also get help and assistance to get vaccine access. Next slide. So this is our final slide. Again, for more information, you can go to sf.gov/COVID-19-vaccine-San Francisco. There is also two websites at the California state level, myturn.calca.gov, as well as covid19.ca.gov/vaccines. And with that, we will open it up to some questions.
Great. Thank you so much, Dr. Baba, for that great presentation. And yes, I'd like to invite Katie Tang, also from DPH, to take the floor to help facilitate the Q&A segment with Dr. Baba. Just a friendly reminder to submit your questions in the chat, and every effort will be made to answer all pre-submitted questions and those submitted live during the session. Those that do remain unanswered will be followed up on post-event. So thank you for your understanding on that. Katie, please take it away.
All right, and thank you to those who submitted questions ahead of time. So we're going to start with a few of those first. One of the questions is, are autoimmune disorders like psoriatic arthritis included in the new eligibility group? I apologize if I mispronounced that.
No, you pronounced it correctly. So if the autoimmune disease leads to immunocompromise, for example, if a person has to take corticosteroids or other immune weakening medicines, then yes. It is best to check with your provider to understand if you qualify.
And the next two questions also have to do with whether these conditions are eligible. So does epilepsy or history of brain surgeries qualify for the vaccine?
If the epilepsy or brain surgery has led to disability, then yes. As mentioned, disabilities that are eligible include those in which a person has developmental, medical, physical, sensory, or behavioral health disabilities.
And some states name asthma as a health condition, but not in California. So does someone who has moderate asthma, are they eligible to get a vaccine? And they pointed out that they are 59 years old.
At this time, asthma is not included under the state's current eligibility guidelines.
All right. And there's also a question about other conditions such as autism and when they might be allowed to get a vaccination, either in this phase or some other time.
So beyond what has been outlined in terms of eligibility starting March 15th, we do not know how the state will approach future phases.
Okay. And how about those, would they be eligible for comorbidity conditions that are not on the list, but they're at risk nonetheless?
So while not specifically on the eligibility list, the March 15th populations that have been prioritized includes those with disabilities or health conditions most at risk for COVID, and is indeed trying to address comorbidities. People that are not on that current list or have a comorbidity that is not on that current list, we will wait for future guidelines to see when they may be eligible for vaccine.
Okay. And there's a question about at what point do we think that 53-year-olds without severe health issues might be eligible to be vaccinated?
So the federal and state governments are driving the prioritization process. And we currently do not know which eligibility categories will come next. We have heard that the state is moving towards an age-based framework, but we have yet to see the details of that. We have also heard from the federal administration that vaccine is likely to be at levels that would allow the general public to get vaccinated sometime mid to late spring.
All right. There's a question about the effect of the vaccines on those with underlying conditions. Can you speak to that?
So in terms of side effects, in these clinical trials, underlying comorbid conditions did not result in a decreased effect of the vaccine. So it should not affect your underlying health condition or the ability for you to mount an immune response for the most part. However, those who are concerned should seek out additional information from their healthcare providers. This is especially important for people who are immunocompromised, as the timing of vaccine should be discussed with a healthcare provider. We do know that people with specific underlying conditions can be at higher risk for contracting COVID-19 and do experience a greater degree of complications from the virus. That is why this group has been prioritized for vaccination.
Okay. And we got a couple of questions about the Johnson & Johnson vaccine. One being, how can they be sure that they can get that and have access to it? And then also, can it be prioritized for this population?
So at this time, Johnson & Johnson is in limited supply. And it's difficult for us to understand when that supply will increase. We do not know how much of the vaccine we will get on a week-to-week basis. And we have only gotten one allocation of Johnson & Johnson, which was a small allocation. I will say the federal government is directly allocating vaccines to pharmacies, and Walgreens and CVS are getting Johnson & Johnson directly. So if there is a preference, someone may be able to get Johnson & Johnson at these facilities. In general, though, most entities cannot guarantee a certain vaccine at this point, just given the limited availability. So by the time, in between making an appointment and by the time you get vaccinated, supply changes may dictate which vaccine you get.
And this is a question that may be addressed both through Dr. Baba, but as well as Director Bond from Mayor's Office on Disabilities. And some of the questions that I saw in the chat, as well as what we received previously, have to do with accommodations at vaccination sites. So for example, lines, or Dr. Baba already spoke to Johnson & Johnson, mobile units being brought to homes. And so perhaps maybe Dr. Bond, if you want to speak to some of the efforts that I know you've been working with the COVID Command Center collaboratively on to increase accessibility, that would be great. And then Dr. Baba can speak on the mobile.
Absolutely. So I can talk about where we are on some things and that are happening, and some things that are evolving and are in progress. So first of all, we know that the city-run and the city-operated sites are wheelchair accessible. We know that our sites have ambassadors and folks that can help shepherd people through lines and minimize the amount of time that you need to wait in a line. And so if you identify yourself as someone with a disability as you're going to the site and just say, I'm going to need some extra assistance, I'm very confident that our staffs at our different sites can assist you with that. No questions asked. It's a very smooth process from what I've experienced and seen and heard so far. So we've got processes for that, but you might need to do a little bit of self-identification and letting people know what you need. Maybe you'll need a wheelchair or a chair or a way to get through to a shorter line. Please be assured that people are responsive to that if you ask for it. Also, at our city-operated sites, we have video remote interpreting capability, and so and also we're making sure everyone is trained to be able to know how to actually use the video remote interpreting when someone comes in who would need that service and support. Some of the things that we are continually working on with feedback from you as community members and as our COVID command response also evolves with new procedures and processes that are meant to be streamlined and more efficient, are really looking at how can we make sure that all of our attestation processes and forms are accessible, especially for folks who are blind or low vision and need that kind of access. We're also really looking at how can we be the most responsive as we can be to folks who are who identify as having intellectual or developmental disabilities and may need a specific kind of attention or service as you're going in for your vaccination appointment. And then some of the other things that we're thinking about and are really, as we learn specifically what works best for community members as you begin to schedule your vaccination appointments, we're also trying to be responsive by neighborhood. So we're in conversation about mobile vaccination possibilities and also possibilities for vaccinating those who aren't able to easily get out of their homes to a vaccination site. So all of that is evolving and in progress, but more to come as soon as we can on that. Again, a lot of that is contingent on the amount of vaccine that we have and also the capacity that our colleagues in the Department of Public Health have to help to be responsive in that way. And again, I just want to emphasize everything that we're doing in terms of accessibility is it evolves, and there's some things that I think are running very smoothly and some things that we no doubt can do better. So I really want to encourage folks, if there is something that you are concerned about that you're not seeing or hearing or understanding through this process, please do let us know through the Mayor's Office on Disability, and I'll share that information again at the end of our hour today to make sure that everyone has that. We truly do want to hear, because the best way to elevate what needs to happen with our colleagues in DPH and through the COVID command is to hear directly from you. And because we've been able to do quite a bit so far that I'm very proud of as a city. So I'll stop there for now and turn it over to Dr. Baba.
Thank you. And again, just as a reminder, we received several questions about how will people who are homebound receive access to vaccines?
So specifically for the homebound population that are unable to get to vaccine sites, we do have a strategy of sending out teams to get people vaccinated. As Director Bond mentioned, we are aggressively working to figure out what barriers people may have to get to a vaccine site and trying to decrease those barriers. Because the mobile vaccine teams are very time and resource intensive, and it will be, it won't be as quick as being able to get to a vaccine site. So where there are barriers that we can try to, prevent or overcome, that's our first strategy that we are trying to be aggressive with. And we are also rolling out the mobile vaccine for those that are homebound and unable, due to functional and access issues, able to get to vaccine sites. So it is a two-pronged strategy. And also, as mentioned, we are in specific neighborhoods trying to improve access by having clinic sites, neighborhood vaccine sites, and other community outreach and access sites to get people connected to vaccine.
Great, thank you very much. And similarly, there was a question about bringing vaccination teams to underserved neighborhoods such as the Mission, Mid-Market, and Tenderloin. So I think you touched upon it generally high level. I don't know if there's anything else you wanted to add there.
Yes, so for example, in the Mission, we do have a neighborhood vaccine access site at 24th and Cap that is accessible to the community and is really being run by our community partners. And then additionally, we do have a program that can take people from the Mission to San Francisco General to get vaccinated as well if there is excess demand. We are working very closely with our Tenderloin partners. There are several clinics in the Tenderloin, and working with them to see if they can access or they can expand their capacity to provide vaccine to the population in the Tenderloin. Again, working with the trusted community partners to really determine how access can occur at the community level.
Thank you. There's a question about how we're going to vaccinate high-risk individuals who aren't seniors or in an obvious category. So for example, they're in treatment.
And I take it that that refers to people who may be in behavioral health treatment or maybe inpatient medical treatment too. Both of those places have access to vaccine. And specifically, inpatient medical treatment, all of the inpatient facilities have vaccine that they can provide patients with. For behavioral health treatment, whether it's mental health or substance use, there is an effort to have access to vaccine at those places as well. So that is currently being worked on. The city is working with our contracted providers to ensure that there is access to vaccine at those contracted provider places.
Okay. This question, someone asked, why are people with disabilities one of the last people to get vaccine, and how can we better handle a future pandemic?
It's a great question. I think one of the ways that vaccine allocation has worked has been done through prior work on pandemics, specifically flu pandemics. There was a lot of work done around who should get vaccine access, especially around H1N1, and then ongoing pandemics that have come up since then around the flu. So I think this is an open question, and there'll be a lot of lessons learned from this pandemic to incorporate into future planning of how any type of treatment, whether it be vaccine or medical treatment, gets incorporated when you have a new virus or a new disease that comes into a community.
Right. And why is it so hard to secure an appointment for the vaccine?
Yeah, I wish it wasn't so hard. And that's right now because vaccine is still in limited supply. I know it can feel frustrating, but I will say that vaccine every week continues to roll out. So really, there is a level of patience that needs to occur with the vaccine rollout, unfortunately, at this point in time. But the most people over the days to weeks, they are able to get an appointment. And again, I would utilize the resources that we discussed to ensure that there is ongoing that people have ongoing access to vaccine appointments. And if you don't get an appointment on one day, don't get discouraged, because that is not uncommon. But generally, trying over multiple days, people are able to secure an appointment. And Director Bond, actually, I should have said for the pandemic planning or for this question, if you had any input, please feel free to chime in.
Sure. So one thing that I would say regarding the pandemic planning is, as we know, much of how the vaccine eligibility rolled out in California came directly from the state with guidance from the CDC, but it was also a very it was a state-led process. And I know many of you on this call, we're deep advocates with the state to help our colleagues at the state level understand the importance of elevating the needs of people with disabilities. So I would say, one of the things that we need to continue to do is advocate at the state level to help people understand the importance of our being together in community. And then towards the second piece of the question, which was, it slipped my mind, towards, I'm sorry, Dr. Baba, what was the second thing that you were speaking to?
Katie, did you want to repeat the question?
Oh, the second question. Yes, sorry. Let me just go back to that really quickly. I apologize. I mean, was it the question about why it's so hard to secure an appointment? Or
yes, I was going to say thank you very much. I really do want to encourage, and we can put the number in the chat again, perhaps, if you really are struggling with appointment availability through the online process. That is why we have the call center number available for people with disabilities. So I would encourage you also to talk with our colleagues who are helping run this call center, because the other thing I will add is that different options and new options become available every day as we evolve our mobile vaccination strategy, our neighborhood strategy. So even if you don't see the resources right away online, there may be something else that's in the works that you can learn about or perhaps get on a list for. So really use all of your options and know that we're working to be as responsive as we can, but use the call center and use the resources that we have online, and then also check back online frequently. We're really trying to put new information up as soon as we know that the process is available and open.
thank you for that. Now, this is a question also either for Director Bond or Dr. Baba to answer about, there's a slight deviation from San Francisco eligibility criteria in the state. And again, as Dr. Baba mentioned, it was mostly to make it easier for people to be able to access vaccines without having to know if you have type 2 diabetes or not. Now, one of the questions centered around they have a family member in San Jose, for example, who is eligible under our guidelines, but not the state ones. Can they register for an appointment at Moscone? And then I'll ask the second part actually afterwards, but if you could speak to that.
So Moscone has, it uses My Turn, which is a state-run system, and it has eligibility criteria. I believe it's a 50-mile radius. So it will take you through that when you go in, and it will ask for your address, and it will determine if you're eligible. So I would do that process to see if you are able to secure an appointment at Moscone.
And the second part of the question or series of questions that we have received are around, again, the differences, the slight deviation in the criteria. And so if they're signing up through My Turn, for example, the state resource appointment system, then they, there's some questions around what do they click and check, which boxes do they check, because they may not be eligible under the state, but they are under our San Francisco criteria. So questions around what they should do there.
So in general, we haven't deviated from the major categories. It's more in kind of the definition. So again, you can click on obesity, or you can click on immunocompromised, or you can click on diabetes type 2. We've stuck with those large categories. We've just defined it a little bit differently to be, again, more accessible to the population and based on the scientific evidence. And the same with disabilities. So you should still be able to get in based on those large categories, which should be the same in my chart when I last checked.
Okay. Director Bond, a question for you. What can people do if they do not have access to paratransit and want to get to a vaccination site?
Unmute. Okay, so if they do not currently have access to paratransit, one thing that I would recommend is that you do register for paratransit or the Essential Trip Card program through the process that we had outlined earlier. You can do this. The first step is by calling 311. So if you call the 311 Information Center and say, I need transportation access, they can also walk you through the options that we talked about today. And then you could register for paratransit, and then also if you choose the Essential Trip Card program as another option. And I'm just going to take a moment to supplement this information with some information that we received from our colleagues at Community Living Campaign, who are also working to supplement transportation options. So from Kathy DeLuca, she says, if you're an Essential Trip Card user, Community Living Campaign can pay your contribution for your one-time allotment increase to get your vaccine appointment. So this means once you're registered for the Essential Trip Card program, they can help subsidize the cost for you. So you just call SF Paratransit at the 415-351-7000 number and let them know that you'd like financial support from the Community Living Campaign for your vaccine allotment, and you will then get a $60 stipend added to your card for those trips. So that's another option. I would say if all of those options aren't working for you or cannot work for whatever reason, please do contact us at the Mayor's Office on Disability and let's talk through what can work.
A follow-up question that appeared in the chat: does it matter if a person with disabilities is not eligible for this regularly for paratransit, that is?
The answer to that is yes. Our paratransit, the answer to that is no, it does not matter. Yes, you can access paratransit. So our colleagues at the paratransit office have broadened their eligibility criterion temporarily in response to helping with all of the transportation changes that we've seen on our above ground muni buses and our light rail system. And so if you weren't previously eligible for paratransit, check again, because you may be now. We really want to help people mobilize in the easiest way that we can.
Okay, great. I'm going to ask this question, even though I know Dr. Baba covered this in the presentation, but it has been a recurring question around proof of eligibility and what is required. So I know there's certain, there's a health advisory we've issued to make things easier, but maybe Dr. Baba can go through that again. And Director Bond, if you'd like to add anything to that, any kind of tips or suggestions.
Sure. So we issued a health advisory to our healthcare providers, basically saying that we did not want this process to be overly burdensome for the end user. And so providers should use a reasonable process to and verify eligibility. They should not, especially at places that do not have access to patients' medical records, they should not require proof of diagnosis and/or disability, and that reliance on self-attestation would be, would do just as well, and potentially is more feasible and equitable. For healthcare providers that are vaccinating their own patients, they obviously have access to medical records and can do proactive outreach. And then they should also use their clinical judgment in assessing risk, because there is, with all of this vaccine eligibility, there is provider judgment involved. So really, we are wanting to make this as low barrier as possible, and have worked actually very closely with Director Bond to ensure that happens, and would love to turn it over to her to discuss any issues that she foresees.
Sure. So at our city-run vaccination sites especially, which just to clarify for the group, our city-run sites are the Moscone Center, the SF Market, and the and City College. Those are city operated sites. We've really worked to help our colleagues understand that self-attestation means just that. So if you say you have a disability or health condition and need the vaccine, and you've followed the procedures for registration, that's all that you need to provide, really. When you get to your vaccine appointment, you're going to be asked for your ID and your medical insurance card if you have one. And really, that's it. And so we didn't want to create more barriers for you in needing to access medical documentation. We didn't want to create unnecessary burden for our healthcare providers either in providing that for people with disabilities and health conditions. And so I'm really pleased that we've been able to work that out. If for whatever reason, as you're scheduling your vaccine appointment, if that is not working, if your experience is something different, please do let us know, because that is not the intention.
All right, thank you for that information. There were some questions about autism and just some clarification needed here. The question is, isn't it a developmental disability, so it would be automatically eligible?
So if it qualifies as a developmental disability, and again, we are not defining that, we are kind of letting the person who is eligible define it, whether they qualify as a medical, behavioral health, or other spectrum disabilities, that if they feel like they qualify, they can attest to it and receive the vaccine.
All right. There were some questions around the actual vaccination sites, and maybe Director Bond, if you want to speak to this, but in terms of bathroom and chair access for seniors who cannot stand in line and need to use the restroom.
Sure. So as far as I'm aware, and we're working with all of our providers to make sure it's the best experience possible, but our sites have chairs, our sites have folks who are on site that are watching out for people that would need assistance. Our sites have accessible restrooms. So we should be all set. I cannot speak for some of our smaller sites necessarily, but that is the intention for there to be a way to get assistance. And I know at our city operated sites that those features are definitely in place.
Okay. In terms of the list that determines the eligibility, someone noted there are a lot of health conditions that are not found on that list, but can be quite disabling. And so they were wondering how the disability portion was determined. And so maybe we could speak to that.
So the health conditions were specifically determined through the state. The state laid out which health conditions qualified. For the disability side, again, we made it fairly broad that if a person had medical, sensory, physical, behavioral health disabilities, that they could attest to that and get vaccine. But on the medical side, that was determined by the state.
And this is a question about people with active cancer and are doing chemotherapy. Do they need to be re-vaccinated because immune cells, the immune cells are killed by chemotherapy?
That's a great question. I think that's a question that you really have to talk to your provider about. Different chemotherapies affect the immune system differently, so that's a pretty complex question. And I know that all of the physicians that are involved with immunosuppressants and different conditions that cause immunosuppression, whether it's medications or other reasons, this is a delicate balance of when to get vaccinated. Now, in terms of needing a booster shot or other in the future, that is still being determined, not only for people who are immunocompromised, but for the general population. But right now we are going by the guidelines where Pfizer and Moderna require 2 shots and Johnson & Johnson requires 1 shot.
All right. And this given time, this may be our last question, but again, there are many questions that have come in and we can follow up through Mayor's Office of Disabilities for that. So this last question, is there a team of volunteers contacting the elderly about the vaccine and registering them for vaccination?
There are teams within our command center that are working on the senior outreach, and that is an ongoing process. I will say, I think Director Bond would agree with this, is all of this work really does require a lot of our community stakeholders, especially the CBOs that work day in and day out with the different populations, to be involved. And we really do encourage, if you are interested or your organization is interested in figuring out how to connect people to vaccine, we would love that help. It takes a village to get the entire city vaccinated, and definitely no one department and no one city organization can do this on their own. So I would really encourage, reaching out, and we can, provide that information on how to reach out and how to get involved. But yes, there is work on trying to develop lists that we can, reach out to specific individuals to see how they can get vaccinated.
I would just add to that very quickly that we do anticipate that we will need CBO support as we begin to really evolve our neighborhood and mobile sites so that we can target specific populations that are working with CBOs in particular who haven't had an opportunity to have the vaccine yet and are eligible.
Great, thank you. And I'm also going to put a resource in the chat from Senior Disability Action. Thank you very much for offering to support this community. So given time, that's all we have for now for Q&A. Thank you so much, and I'll turn it back to our Joint Information Center.
Thank you, Katie and Dr. Baba, for being here and for facilitating that Q&A. I'd like to hand the mic over to Director Bond for closing remarks.
Great. So we have one more slide that has some contact information. So we're going to pull that up. I just want to say a deep gratitude to Dr. Baba and to Katie Tang and to everyone who helped produce this event today in the Joint Information Center. We really could not do this without all of you. And I really appreciate everyone also who asked such thoughtful and attentive questions, and we really do hope that this session was useful for you. And however, we do know that we didn't get to everything, and so I just wanted to give you a little bit more information about the Mayor's Office on Disability. Our website is at sfgov.org/MOD. You can email us if you have access to email at mod@sfgov.org. So if there's something that didn't get answered today, we'll be sure through, I still work directly in COVID Command every day. So we'll make sure we get your questions referred to the right folks. If you don't have email, our phone number is 415-554-6789. You can leave a message there. I also encourage everyone, if you're not signed up for the Mayor's Office on Disability news alerts, where we're sending out updates as soon as we have them about availabilities and new and evolving things happening, please do sign up for that. you can go to the bottom of our website homepage and you'll find it there, or you can send an email to us at MOD letting us know that you'd like to be added to the distribution list. And finally, if you'd like even more information about how we're doing on the vaccine rollout for folks with disabilities, there's another opportunity for there's a public meeting of the Mayor's Disability Council this Friday, the 19th, from 1 to 4. You can attend virtually or SFGovTV. And you can see the agenda. The agenda is available on the MOD website. And so that will vaccines will be a major topic, as will a discussion with Supervisor Chan about Golden Gate Park access. So we hope you can join us for that. And I really want to thank everyone for joining today. Again, if you'd like to contact us, please use our email or our phone number, mod@sfgov.org or 415-554-6789, and let us know too what you think of how we did today. We hope that this was responsive for you. And again, if there's something that where you'd like more information, please do let us know.
Great. Thank you so much, Director Bond and the MOD team and our team at DPH, and to everyone here today for joining the COVID-19 Vaccine Town Hall for people with disabilities and health conditions. As stated before, for more information or if you have any further questions, please do reach out to mod@sfgov.org, mod@sfgov.org. Thank you again, everyone, and have a great evening. Take care.